Hi, my name is Angela Cunha, and I'm filming my Foley Catherization exam video submission. So when I come in, knock, knock, we provide privacy for the patient. Hi, my name is Angela, and I'm going to be your nurse today. Can you please tell me your name and date of birth?
Pat Smith, 1195.
Awesome. So that's what I have on your armband. So I went ahead and reviewed your chart, and it says that the provider has ordered a Foley catheterization on you today. Do you know what that is?
No.
No. All right. It's a small tube that goes up your urethra and into your bladder, and it helps drain the urine out from you. Do you have any questions about that?
No.
No. Okay. Great. So before we get started, I need to ask you, are you allergic to iodine, shellfish, or latex?
Nope.
No? All right. So let me go ahead and put on the gloves. I'm going to go ahead and put you in position that I need to put you for the procedure, okay?
Okay.
All right. All right. So I'm going to go ahead and stand it out here and everything. Lift up legs. And at this time, I'll go ahead and perform pericare on the patient. Okay. All right. Okay, so I'm gonna go ahead and be setting up my sterile field. So my back's gonna be towards you, okay? So if you have any questions, just let me know, all right?
Okay.
Okay. So I see here I have my Foley catheterization, my Foley kit, I'm sorry. It's a 14 French. It has 10 milliliter sterile water that I need to put in. It expires on 8/31 of 2021, which is okay. And it looks like the package is intact. There's no rips or moisture, so it's okay to use the package. Okay, so I'm gonna go ahead and open this up. I'm gonna go ahead and get a trash bag. We're gonna put a little trash bag by your hip here, okay?
Okay.
All right. Go ahead and put the flap, move the first flap away from me. Got my 1 inch border, making sure everything's okay. I'm gonna grab this. I'm gonna have shiny side towards me. Okay. Put that in there. I'm gonna imitate that I'm going underneath the patient's legs and pulling up more towards the body. Minding my 1 inch borders. Okay. So I see here that there's sterile gloves in the kit, but I'm not going to be using it. I'm going to be using my own. So I have here a size 8 sterile glove. Looks like it expires for 7 of 2017, but for testing purposes, that's okay. I see no rips, no rips, no moisture. Everything seems to be intact. Okay. I'll go ahead and I got stuck. Okay, so I have my sterile gloves on. So I'm gonna go ahead and then we're gonna begin cleaning. So let me get my kit ready here. All right, go ahead and transfer it over to the patient. All right, so we're gonna go ahead and begin cleaning, okay?
Okay.
Okay, so I would go ahead and spread and wipe the labia from outer to inner using all the cotton balls provided. From outer to inner. Okay. All right. Go ahead and I'm going to go ahead and insert. So if you can, just take a deep breath for me, okay? I'm going to insert this.
Okay.
Okay. So I'm going to go ahead and insert the catheter until I see the urine, and then go in for another 2 inches more. Okay. I'm gonna, oh my God. So I did break sterility. The catheter came out, and I do understand that. Just having some problems here. Putting this in this awkward angle. Okay. In. I'll go ahead and push the sterile water in. And then pull back until I meet resistance. Okay. Okay, ma'am. So I have the catheter in place, but it's not quite secured yet, okay?
Okay.
Okay. So at this time, I'm going to go ahead and I'm going to attach the catheter on the side of her leg here with some tape. I don't have any of it, so I'm going to pretend that it's there. Let the bag hang down. I'm going to go ahead and, I don't have a hook, but I do have a little arm here that I'm just going to hang on there. Okay. All right. I'm sorry, it's going all over the place. Okay, all right. And then it's all taped down, everything's hanging down. Okay, how was the procedure for you?
That was fine.
That was fine? Okay, so I would document that I inserted a 14 French Foley catheter with 10 milliliters of sterile water into the balloon. I would also document the color, clarity, and odor if I emptied it out, and notate the amount of urine that came out of the catheter. I would also document when I inserted it and how the patient is tolerating the procedure after the procedure. And then I will wash my hands on the way up. All right. So it's now 3 days later, and say, hello, my name is Angela. I took care of you a few days ago when I put the Foley catheter in you. Can you please state your name and date of birth?
Pat Smith, 1195.
All right, so perfect. So I looked at your chart and the provider has ordered for me to take out your Foley kit. I'm sorry, I forgot this. And it looks like so it'll be a pretty quick procedure, okay? I'm gonna go ahead and take out the Foley kit, and it'll be a pretty quick procedure. It shouldn't be too painful, and we'll get that out for you, okay?
Okay.
Okay, first, I'm going to go ahead and empty the bag, so we can put some gloves on. And I'm sorry I did not put my trash bag away from the patient. I should have done that way back after I got done with the catheter. So I did break a little sterility. I didn't follow that. I'm sorry, but I am aware that after catheterization's in, to remove all trash away from the patient. So I'm gonna go ahead and bring my blue chucks and my vein. I'm gonna go ahead and lay that on the floor. I'm gonna go ahead and empty it out. Hook the alligator clip and the metal clip. Let it all drain out. Okay. Put a metal clip back in and the alligator. Okay. And I'm gonna go ahead and push this to the side so that way I don't trip all over it. Okay. All right. Okay, so normally I would passively deflate this, but for testing purposes, I'm going to actively deflate the balloon. And I'm gonna pull until I see bubbles in the bifurcation. All right. And I'm gonna go ahead and remove the catheter. Okay. How was that for you? Was that okay?
That was fine.
Okay. Okay, so great. So we want to make sure when we monitor your next 3 voids, making sure that you don't have, make sure you let us know when you do need to urinate, so that way we can monitor if you have like a UTI, like a urinary tract infection, okay? You do understand that, correct?
Yes.
Okay, so then I would document the patient tolerate the procedure well, and then I took out the catheter, but I would notate the color, clarity, and odor from it. Document the patient tolerate the procedure. I took the catheter out, and I took out 10 milliliters of sterile water out of her. And then I would document the amount, clarity, odor of the urine from the bag, and then the patient tolerated it. And then I will wash my hands when I leave the room. Thanks.